Hello, my name is Karen Latson, and today I'm going to be discussing a policy relevant problem that is currently occurring today. I'm doing this class for my Healthcare Policy and Politics and Power class. Today's date is the 24th of May, 2020. So, the policy relevant problem that is relevant today is the amount of adolescent obesity, obese children that's leading to a strain on the national healthcare system because we all know obese adults have more health problems. According to the CDC, they said that about one third of Americans are classified as obese. So treating obesity and obesity related conditions costs billions of dollars. Cawley stated that the U.S. spent 190 billion on obesity-related healthcare expenses in 2005, which doubled the previous estimates. We all know that adolescent obesity is a growing problem within the United States, and it has continued to steadily increase even since the 90s. Adolescent obesity is a consistent contributor to the increased chronic conditions that continue to result in higher utilization of medical services, from expenses such as healthcare procedures, extensive inpatient admissions, rise in pharmaceutical costs, and staff safety, and also staff availability. All of this stuff takes a large hit when dealing with obesity. So, looking ahead, researchers have estimated that by 2030, if obesity continues to be unchecked or we don't get a better control of it, the obesity related medical costs alone could rise from 48 to 66 billion a year in the US. We know what behaviors are needed to treat and prevent obesity. We just don't know how to get individuals or society to do them in a more persistent way. We shouldn't be wasting money on healthcare services to combat a problem that I feel we can stop before it starts. So this problem is important because it affects a whole host of individuals. For one, the patient's health alone is affected. We all know that obesity has a variety of impacts on the body. When it comes to being obese, obesity is basically accumulation of fatty tissue that causes pressure on the internal organs. And by doing this, it results into a multitude of health conditions such as high blood pressure, type 2 diabetes, COPD, sleep apnea, and a whole host of other issues as well. A lot of these issues require a lot of staff assistance. So now we're moving along into staff safety now, which could pose harm for them. Healthcare workers are put at risk physically due to the additional strain that they inherit from helping these obese patients with these mobility issues. For example, in order to prevent skin breakdown in the immobile patient, staffs have a schedule where they have to rotate the patients every 2 to 4 hours. This alone may require additional staff depending on the weight of the patient. And if there's no additional staff available, then you have a staff member potentially trying to make these things happen on their own, which could potentially put their health in jeopardy, trying to reposition a patient or lift up a patient leg. This in turn will result in staff member either being hurt to the point where they're unable to perform their duty, the patient being hurt, um, and also the patient being hurt and potentially wanting to pursue a lawsuit, which is ultimately going to cost healthcare money as well as providing healthcare payments for the staff member that was hurt. So all of this plays an intricate part in dealing with an obese patient. That brings us to the financial impact on the health system. There's numerous of situations that fall under the financial impact on the health system, such as an increase in patient admission. When it comes to obesity and related chronic conditions, there's a lot of there's a major increase in patient admission due to the conditions that the obese patient may have, whether it's either from an inpatient being put in due to a respiratory issue, a cardiac issue, an orthopedic issue, whether it's a inpatient admission for the long haul or a ER visit or orthopedic procedure, which is going to require the patient having to stay for longer periods of time. And when it comes to that, the orthopedic procedures we know are more common among increased weight in obese patients because they have a disease known as arthritis that has a higher chance of needing orthopedic replacement procedures, which potentially puts them in a position where they have to stay in the healthcare, have to be admitted for a long period of time. According to Muzak, a researcher, he said that healthcare, when it comes to healthcare utilization, obese patients are more likely to have longer and frequent inpatient visits than those with a normal weight. And that is ultimately due to them, one, being obese, and depending on what they actually came for, due to the impact of the excess weight, playing a major part on their heart, as I said before, playing a major part on their cardiac system and other major organs in their body. Um, the article that was written by Stuart B. On obesity, disease burden, and prescription spending, he stated that there are several studies that have also linked higher prescription drug utilization among patients with chronic conditions related to obesity, such as diabetes, hypertension, heart disease, and arthritis. So not only does it creates an increase in inpatient admission, it also increases how much medication, you know, how much medication the hospital has to actually potentially pay for. So we know that obesity affects the pharmaceutical kinetics of the body, which in turn leads the patient to requiring frequent administration or higher doses of medication, frequent care from the staff, meaning that the staff has to constantly be monitoring them, being around them, making sure that they're not going into cardiac arrest or, you know, no type of respiratory issue. All of this has the potential to increase the cost of pharmaceuticals from what a hospital is already currently spending. So when you get down to that, now that doesn't even take into account the non-reimbursable treatments, because of the increased amount of fatty tissue on an obese patient. They have the potential of running the risk of getting infections, also of having certain wounds being separated and opening back up from having procedures performed. In some cases, the Center for Medicare Services, the CMC, will not reimburse hospitals for these type of situations, because they feel like this situation occurred in your facility and it has nothing to do with us. So they won't even reimburse the hospitals with that. Obesity also creates an impaired mobility for these patients, leading them to increased risk of falling. And this is another issue that the CMS and most hospitals will not reimburse because they feel like this was acquired while the patient was hospitalized. Um, then you get into the cost of equipment. That's another thing that runs high when it comes to obese patients. Some hospitals have had to consider ordering bariatric equipment, including hospital beds, bigger beds to accommodate obesity patients, wheelchairs, bedside commodes, walkers, as such. According to the American Institute of Architects, 2016, hospitals are seeing an increased numbers of obese patients. Hospitals that see an increased amount of obese patients are looking towards expanding their hallways and opening up their doorways just to be able to accommodate the amount of obese patients that they see on a day-to-day basis. And I'm sorry that this keeps popping up. I don't know why that keeps popping up. So pretty much, like I said, obese patients are pretty much adolescents and adults are pretty much putting a higher strain on the healthcare system by, you know, not only the health of the putting a strain on the health of the patient, which also impedes on the staff safety and the amount of staff that needs to be hired to accommodate these patients, and also the financial impact on it, the increase in patient admission, the more patients coming in, um, the increased spending on the pharmaceuticals to be able to treat the illnesses that they incur, the non-reimbursable treatments that they're not getting reimbursed for, due to certain situations that may have occurred in the hospital, and them having to acquire equipment that can accommodate, the sizes of the patient. So this policy is basically going to target a multitude of people. For one, it's going to definitely start with the parents and the community. For one, the parents are the integral change agent. Okay, they are responsible for the meal planning. They plan, they prepare, they purchase these meals. So they're responsible for the activity planning, and the primary should be primary role models for their children. So this policy is definitely going to affect them, because this policy should be able to place emphasis on the importance of, family members being able to go out and provide their kids with proper nutrition, and educating them on the importance of, being healthy, so that they don't run into the issues of dealing with, the medical issues that come with obesity. Um, it's also going to tie into the community as well, because the community needs to be able to be educated on how important it is to provide those facilities for those kids to be able to go outside and and react in physical activity, ensuring that the playgrounds are up to par, ensuring that the sidewalks are not damaged. Just different things in the community to be able to educate not only the parents and the community, to create that environment that's going to be conducive, so that the child does not grow up and potentially veer off into the obesity route. So basically just raising awareness about the effects of being overweight and its overall effect on the child's health and the parents' health, informing the leaders about the importance of developing healthy communities, and promoting outdoor activities and stuff of that nature. Um, the schools is a target audience, because most children spend a large portion of their time in the school. The schools provide much more of an opportunity to be engaged with the kids when it comes to eating and physical activity, and they're able to reinforce a healthy diet and physical activity throughout the school day. So basically just building that awareness among the teachers, the food service staff, coaches, and nurses on the importance of physical activity to be able to maintain that healthy weight. Then you have the healthcare providers. Healthcare providers pretty much are going to be a target audience, because these are people who the parents and the community rely on to give them that advice as to how they should live their life, to be able to be healthy and be able to live longer. So we should aim at the healthcare providers, and helping to reduce the widespread of obesity by providing education and prevention to these parents and also the children, and informing and educating the healthcare community about the importance of healthy eating that is consistent with the dietary guidelines. Um, so that's why we should target pretty much the healthcare field. We definitely should target the media. The media is definitely plays an integral part in it, and basically encouraging them to do national campaigns that's going to foster public awareness of the health benefits of physical activity and how important it is to work out, and not so much as showing letting them know that eating and physical activity lifestyle is for health rather than for appearance. So not just promoting sandwiches on TV, and not showing the showing the benefits of maintaining a healthy environment, and not so much as going by what something looks like, but really investing in knowing the effects that it has on an individual's health. And then lastly, the policymakers, because they're the ones that's going to ensure the funds are put into place to combat this obesity. So just ensuring that the policymakers are aware of the need to develop social and environmental policies that will help communities and families be more physically active and consume a more healthier diet. And just providing education to the media on these policies, and enforcing that they put some ads out that promote healthier options, or ways of being healthy, and not going so much into that obesity route. So this brings us to our policy relevant question. How do we change our society to live more healthily in a way that is good for individuals, society, and economy, and consistent with the American values? The bottom line is prevention is key. Okay, it is possible that if we have a clear understanding of the cost of obesity, it will spur larger and more urgent programs to be able to prevent and treat it. Now, we have made some